This is a summary of the CPIC dosing guideline for PEG interferon-alpha-based regimens and variation in the gene IFNL3, also known as IL-28B. This guideline was last updated in February 2014. Due to differences in the likelihood of sustained virologic response, it is recommended that consideration be given to IFNL3 genotypes prior to initiating treatment with PEG interferon-alpha-based regimens. Patients with a favorable response genotype have an approximately 70% chance of sustained virologic response after 48 weeks of treatment with PEG interferon-alpha and ribavirin, and an approximately 90% chance after 24 to 48 weeks of treatment when also receiving protease inhibitors such as boceprevir and telaprevir. Patients with an unfavorable response genotype have an approximately 30% chance of sustained virologic response when receiving PEG interferon-alpha and ribavirin alone, and an approximately 60% chance when also receiving protease inhibitors. Infection with the hepatitis C virus affects over 150 million people worldwide. It is one of the leading causes of cirrhosis and hepatocellular carcinoma. Prior to 2011, hepatitis C was treated with PEG interferon-alpha and ribavirin only. However, in 2011, the protease inhibitors boceprevir and telaprevir were approved for use in multiple countries. These drugs are given in combination with PEG interferon-alpha and ribavirin. The primary goal of hepatitis C treatment is to achieve sustained virologic response. Sustained virologic response, or SVR, is defined as undetectable serum viral RNA 12 to 24 weeks after the end of treatment. SVR equates with cure of the hepatitis C infection. Variation in the IFNL3 gene, also known as IL-28B, is the strongest pretreatment predictor of response to treatment with PEG interferon-alpha and ribavirin-based therapies in previously untreated patients with hepatitis C genotype 1. The IFNL3 protein belongs to a family of proteins which engage in antiviral, antiproliferative, and immunomodulatory activities. However, the mechanism by which variations in the IFNL3 affect antiviral response are still poorly understood. Two of the most commonly tested polymorphisms in the IFNL3 gene are rs129-79860 and rs80-99917. These variants are in close proximity and in strong linkage disequilibrium. The CC genotype in rs129-79860 and the TT genotype in rs80-99917 are associated with a more favorable response to treatment with PEG interferon-alpha and ribavirin-based regimens. Patients with these genotypes show a higher SVR rate as compared to those with an unfavorable response genotype. These are the CPIC dosing recommendations for PEG interferon-alpha-based regimens. Patients with a favorable response genotype who are receiving only PEG interferon-alpha and ribavirin have an approximately 70% chance for SVR after 48 weeks of treatment. Consider the implications before initiating regimens. Patients with a favorable response genotype who are receiving PEG interferon-alpha and ribavirin in combination with protease inhibitors have an approximately 90% chance for SVR after 24 to 48 weeks of treatment. Approximately 80 to 90% of patients are eligible for shortened therapies, which weighs in favor of using these regimens. The classification of this recommendation is strong. Patients with an unfavorable response genotype who are receiving only PEG interferon-alpha and ribavirin have an approximately 30% chance for SVR after 48 weeks of treatment. Consider the implications before initiating regimens. Patients with an unfavorable response genotype who are receiving PEG interferon-alpha and ribavirin in combination with protease inhibitors have an approximately 60% chance for SVR after 24 to 48 weeks of treatment. Approximately 50% of patients are eligible for shortened therapies, which weighs in favor of using these regimens. The classification of this recommendation is strong. All of these dosing recommendations can be found in Table 2 of the guideline. Detailed footnotes pertaining to the recommendations can be found at the bottom of this table. A link to the guideline is provided in the description below this video. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where an activity summary can be given for specific combinations of alleles. The activity summary includes implications for the combination of alleles and the strength of the guideline recommendations. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guidelines or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.